This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit AmericanMobile.com to get started.
How many babies will you have at one time?
So typically in the NICU, at least where I'm at, is the most we can ever get is three patients. So we'll get three babies to one nurse. So that is as much as we can get, or at least as much as I have been able to get. And the most common, though, is usually two babies to one nurse. And that's very typical, and we'll see that a lot. And it really all just depends on the acuity level. We have some patients that are extremely, extremely sick. So those babies will be more one-to-one, where they need one-on-one monitoring. But yeah, so right now I do primary one patient, and a lot of times that baby is assigned to another patient. So I have two most of the time, unless I am caring for a patient that's extremely critical and has a lot of IV lines and intubated and things like that. But yeah, typically two babies is the most common.
Okay. So walk me through typical day start to finish. You do 12-hour shifts?
I do. I do 12-hour shifts. I also do kind of like a rotation. So I do day shifts and I do night shifts. And so it's nice because I get to see both sides to things. As a new grad also, I was kind of rotating a little bit as well, where I did my orientation, most of it on days and the second half of it on nights. So I got to see the differences, and there's definitely huge differences between the two. My day shift schedule is typically, I start my shift at 7 a.m. So I'm not a morning person. Waking up early is a little bit challenging for me. But yeah, typically start of shift starts at 7. We give our handoff report and get information on our patients. And then typically the first thing I do is I go into my patient rooms, whether parents are in there or not. I introduce myself to them. And in the NICU, we wipe down every single surface that we touch, high touch areas. Preventing infection is super important in the NICU because these babies are basically, we consider them immunocompromised in a way. They can get sick very easily. So we wipe down all our surfaces. And in that meantime, while I'm doing that, I kind of observe my surroundings and see what I need. One thing I've learned and one thing I share with all my new grads is kind of prepping yourself for success at the beginning of your shift by gathering all your supplies. I think that is one thing that I've learned, and a habit that I keep with me every time I do my shift, is setting myself up for success, grabbing all the necessary supplies. So I will go around and observe my surroundings, see what I need, like diapers and baby wipes, getting oral syringes for feeds, anything like that, and just prepping it in my mind. And that way, when I go to the supply room, I grab all my stuff. So once I'm in the room and I'm doing my assessment, I am ready to go. I have everything I need. And that's just one thing that I feel like that helps with time management a lot. As a new grad, there's times where you forget stuff and you're running back and forth, and that wastes a lot of time. And with NICU, especially if you have three patients, time management is key. So gathering the things you need at the beginning is super important. But yeah, usually I'll do that and check on all my medications that are due for the shift. So I have a brain sheet that I'll write everything down, see what else I need to do for the rest of my shift, like any diagnostic tests like x-rays or any blood gases I need to do for the day, write it all out. And then I kind of get started with my assessment. So in the NICU, we kind of time our patients. And as bad as that may sound, it helps with time management a lot to know what patient we should do first. So usually I'll start one of my patients at 8, then I do my next one at 9. And that helps with our feeding schedules too, because babies eat every 3 hours. So we just do like a consistent schedule with them. So my 8 o'clock baby would be 8, 11, 2, and 5. My 9 o'clock baby would be 9, 12, 3, and 6. So you see that schedule is already played out in my head, and I already know what the plan of care is for the day for each patient. This is when I'm going to be going in, doing my assessments, my feeds, and my cares, and all that. And so it also helps us when we discuss with team members also the times we're going in for the patients. That way they can come in. We love to group our care. Coordinate our care with other team members, and so they will come in during a time we are assessing them, and they'll do their assessments, and we discuss the plan of care for the patient, and then they do their roundings. So they come around and we discuss any changes, anything that we want to change for the plan of care for today, things like that. And then it can be a routine thing too, because as you can see, my schedule is routine. Every 3 hours I go in for the patient, do pretty much the same thing, assessment, care, feeds, and stuff like that. But things can happen, you know. It's one of those things where you plan for a certain schedule to be a certain way, and something comes up, and I have an x-ray coming in out of nowhere, and they want to make order changes out of nowhere. And so I have to accommodate for all those things. But that's kind of day shift. We do a lot of off-unit procedures during day shift as well. So planning for surgeries in the morning, taking kids to go to MRI, CT scans, things like that. So day shift can be a little bit more hectic in a way that there's just a lot of people, a lot of off-unit procedures, things going on. But day shift is a little bit different than nights, because nights can be a little bit more mellow, where and what I mean by that is just less people on the unit in general. Like everyone is usually gone by then. And so it's a little bit more quiet. The routine is still there though. We still have our every 3-hour cares, but it can be a little bit different at the beginning of shift. I feel like night shift at the beginning is always a little bit busier for me, because typically on nights we do baths, weights, and changing of linen and things like that. So it can get a little busy, especially if you have 3 patients, and if they're all due for baths that night, then you are running around like crazy at the beginning. But then the rest of the night can start to mellow out a little bit. And of course, like every shift, things can happen, things can change, things like that. But most of the time it can be a pretty repetitive thing. So ICU is great in that way, and I feel like NICU especially is great in a sense that we do have critical moments where things can get a little hectic, crazy, busy, but we do have stable moments as well, a little bit more chill days. And so I kind of thrive in those kind of environments where it's not crazy busy 24/7, because I don't think I do well in that. So if you are one of those people that consider ICU but are very hesitant, nervous about just that critical care constantly, at least in NICU, it is not one of those cases where it is all the time. But if you want to do ICU and you're hesitant about that, I think NICU is probably a great place to start out. And of course, it is an ICU in a way as well, so you do have to prepare for those crazy days and caring for extremely sick patients. But there are days where we do have some pretty cool moments, and we get to hold babies and walk around the unit, and so it's always a great time.